It was an amazing educational experience and really something that went above and beyond anything I was expecting before joining GlomCon's fellowship, and learning from faculty from essentially all over the world. Hope to create a glomerular disease clinic here at UC Davis.
When I applied to the fellowship, my initial thought process was I was really hoping for a platform through which I could consolidate the foundations of my understanding of glomerular diseases and how they're managed, but also get up to speed with all the cutting edge research going on in the field and understand the nuances of all the clinical trials that guide our day-to-day management decisions. I can think of no better way of pursuing this interest than through the GlomCon Fellowship. I can say I got all of this and so much more. I met an incredible group of individuals from all over the world. I'm proud to say that I can not just call them my colleagues, but also my friends. And I'm really looking forward to a future in which we all work together to make the lives of those with glomerular diseases just a little bit better each day.
But reality even exceeded my expectations. It's been a wonderful year, learning directly from experts in the field. GlomCon Fellowship taught me how to become a better clinician, but also inspired me how to become a better educator.
It's been an incredible 10 months. It really helped me improve the care that I deliver both in an outpatient and an inpatient setting, and it's really improved my confidence in managing glomerular disease. It has also really inspired me to work with one of my fellow attendings on a project to develop a uromicroscopy service at our hospital, and I look forward to carrying all this knowledge forward, and it's been a great experience for me.
The fellowship was an amazing opportunity for me to deep dive into glomerular diseases, to learn about their complex pathophysiology and the new emerging treatment options based on the most recent cutting-edge research, even from trials that are yet to be published, and to learn from the brightest and most experienced clinicians at the forefront of this young and emerging field. It helped me appreciate the nuances in the manifestations and management of the different glomerular diseases, and to understand how important it is for us to enroll our patients in clinical trials. I was also lucky to have made so many new friends and contacts through this forum. Going forward, I will always look to them for their opinions in managing some of these complex and interesting cases.
I feel very lucky to have participated in the GlomCon Glomerular Disease Fellowship, and that's because I felt very uncomfortable before doing this fellowship, taking care of patients with glomerular disease. After this year, I feel much more comfortable recognizing and treating patients with glomerular disease. So I'm very thankful to have this opportunity, and I think for me, the way this has changed my career, it's made me much more interested in merging my glomerular and transplant interests. So I'm very thankful to have had this opportunity.
With the fantastic directors and the amazing faculty, it has been much more than I expected. It has not only increased my clinical knowledge and skills, it has also been really inspiring when it comes to research. There's been a lot of emphasis on how to present data, and that has definitely improved my skills in that area. And it has also been just so much fun to learn to know all these colleagues from all around the world, and I've learned so much from their work and presentations. It's been an amazing year, and I'm definitely going to miss this fellowship.
It was one of the best decisions that I've made. Actually learned a lot about glomerular diseases, way beyond what I could have learned from fellowship alone. I also collaborated with multiple staff and people all over the world.
I joined the GlomCon Glomerular Disease Fellowship so that I could learn more about how to manage complex glomerular diseases, and so that I could improve the patient care that myself and my colleagues provide. Interactions with expert nephrologists, informative and interesting. I've already been able to apply what I've learned to patient care. I've been able to help my colleagues with difficult cases, and I've been able to present interesting cases to my private practice supporting nephrologists. I plan to open my own glomerular disease clinic in the near future. I highly recommend the fellowship, and I'm so thankful to everyone who has made it possible.
It's been an amazing experience. I've learned so much. I've been able to interact with pace setters in nephrology, and I believe that this has further armed me to be able to manage my patients much better and to contribute to research and knowledge in the field of nephrology.
I joined the GlomCon Fellowship because I knew I was going to be able to learn from the best. It was amazing to receive lectures from experts, but it was also a great experience to prepare presentations in a topic and share it during the workshops, where I was able to receive feedback and open a discussion with my co-fellows. At the end of the fellowship, I felt very comfortable looking at nephrology slides and discussing findings with my peers. Joining the GlomCon Fellowship was definitely the right choice for me.
I applied for this GlomCon Fellowship to get a deeper insight into glomerular diseases. I could achieve this and much more beyond my expectations from this fellowship program. So we all grew as a family, and it is sad that now it has come to an end. I would encourage all early career nephrologists and nephrology fellows to apply for this fellowship program and make the most out of it.
Participating in this GlomCon Virtual Fellowship has been really helpful to ease the transition and help me better better treat my glomerular patients. There was one area leaving fellowship that I did feel a little bit uncomfortable with. It's really helped me better manage my patients and feel more comfortable with treating glomerular diseases.
I really learned a lot from this 1 year glomerulonephritis fellowship with GlomCon. This 1 year really fellowship gave me the passion and the self-confidence to have my own glomerulonephritis clinic in my institution.
And I loved our fortnightly interactive workshops led by expert faculty from all over the world. We covered every glomerular disease, from clinical presentation to histopathology, from management to future therapeutic directions. I feel better equipped in my role as a nephrologist with patients coming through the ward and my clinic. And whilst I've developed my own framework, I found those little pearls of wisdom extremely helpful in better equipping me in my role as an educator. And finally, I love the network. The cohort made the fellowship. Each fellow brought their unique perspective with their different patients and challenges and the varying cultural and practical aspects of practicing nephrology.
I joined GlomCon because I felt I wasn't good at glomerular diseases in general, so I wanted to learn from more. And GlomCon was the best forum to learn from the experts. What I got from GlomCon and academically, I feel I know a lot. I can discuss more about glomerular diseases and get into nuances of it. Clinically, I think I have a different view in approaching patients. With each session of GlomCon, I felt like I was improving and being more thorough.
I would highly recommend GlomCon to anyone wanting to boost and supplement their nephrology training. It was a fantastic experience. It's a great way to get your head around all that tricky glomerulonephritis stuff in a really supportive group of other international nephrology trainees.
As a part of this fellowship, I got to hear right from the basics like spinning of the urine to the complicated topics like genomics and genetics, glomerular diseases and transplantation, glomerular pathologies and the paraproteinemias from the best of the experts in the respective areas. And undoubtedly, I'm a lot better than what I was 1 year ago in expanding my differential diagnosis for a glomerular case. And as I graduate from this fellowship, no doubt I'll miss out the case discussions, exciting lectures, and all my dear fellows. I can vouch for 1 year of lively and exciting training.
I joined the GlomCon Fellowship program because I wanted to improve my knowledge in glomerular disease. The management of my patient has improved since I began the fellowship program. The most important thing is that my knowledge in the diagnosis, the management, and the kidney pathology has improved with this fellowship.
I've just completed the 12-month GlomCon Glomerular Disease Fellowship and it was fantastic. It provided a friendly and collaborative environment to learn about glomerular diseases from experts from all across the world. It was fun, interesting, and relevant to daily clinical practice. I've really enjoyed the last 12 months and I would highly recommend the fellowship to anyone who might also be interested in extending their knowledge of glomerular disease.
The fellowship overall has helped me grow both personally and professionally. It's helped me gain an active insight into these disorders. I've had amazing mentors, colleagues who've helped me. I've seen cases and managed them actively from an array of atypical anti-GBM to Fabry's disease to rare genetic disorders. I feel much more confident after this fellowship in managing these disorders independently. My final goal was to start a GM clinic here in Danville.
From the fellowship, I have gained more confidence in the management of glomerular diseases because the approach is very practical, but it also has helped me to meet new people and to make contacts to try to start a career as a researcher in nephrology, which is something that I wanted.
I just want to say it was an absolute pleasure working and learning with my peers. It was a great experience. I personally learned a lot. I could actually feel in first couple of months I had better understanding of pathophysiology of glomerular disease and also my management and differential broadened.
I think the program is outstanding because of a couple of reasons. We received the lectures from the world experts in the respective topic and also peer-to-peer learning. We had an incredible leadership. Now I feel very confident while giving discussion with the patients and fostering the clinical features in the treatment options.
I had an amazing time being a fellow at GlomCon's virtual fellowship. This hugely complemented my general nephrology training as well. Through the highly impactful talks from the faculty on the subjects in combination with very practical case-based discussions, the learning was quite transformative for me. I feel comfortable taking care of patients with GN now than I did a year ago. As I step into becoming an attending myself, I'm certain the learning from this fellowship will help me make better clinical decisions.
It's been a great honor this year to be part of the first graduating class of the GlomCon Fellowship. My knowledge of GNs has grown exponentially being a part of this group and gives me the confidence to make GN one of the focuses when I take up my first job as an attendee.
For me, it was an honor to be able to participate in such an enriching experience. For sure, GlomCon helped me to update my knowledge about glomerular diseases and offer my patients the treatment based on the most recent medical evidence available.
This fellowship meant to me a great experience. I met lovely co-fellows from all over the world with outstanding careers and that are excellent human beings. I met marvelous faculty that spend their valuable time to share their knowledge with us, and compromised and passionate directors that also teach us many things. It was an opportunity that happens once in a lifetime and helped us to be better nephrologists.
I'm so proud of being part of this first class. This virtual glomerular disease fellowship by GlomCon not only allowed me to reinforce and acquire new knowledge on glomerular diseases, but also gave me the opportunity to connect with such extraordinary fellows and glomerular diseases leaders from around the world.
GlomCon Fellowship helped me to improve my understanding how to approach patients with glomerular diseases, diagnostics, and management of GN. I feel more comfortable caring for my GN patients, discussing treatment options and prognosis with them.
GlomCon provided us with a platform to network with like-minded fellows from across the globe, and we were privileged to have excellent teaching sessions from experts across the world on glomerular diseases. Our teaching sessions were case-based, interactive, and focused on problem-solving skills. Overall, I have learned so much, have gained so much inspiration, and most of all, I have made some great connections with like-minded nephrologists from across the world. I would highly recommend the GlomCon Fellowship to renal trainees and early career nephrologists.
The GlomCon Virtual Fellowship has been an amazing learning experience for myself, and I feel very fortunate to have been able to join. It has been able to successfully complement my training by providing an avenue to meet and work with experts in the field and fellow Glom enthusiasts. It is my hope that after this fellowship, I have been able to hone my skills to be able to help establish our GN clinic, share my knowledge with my peers, and of course provide better care to our Filipino patients.
And I'm very proud to say that I am part of the GlomCon GN Fellowship in 2021. Each session was delivered with world-class experts, and all of them had a great passion for teaching. The program itself was very well organized, and even in a pandemic, the lectures and workshops were amazing. While I've learned a lot, I met an amazing group of co-fellows that made each session better with their outstanding presentations, questions, and discussions.
My main goal was really to learn more about what can be quite rare conditions. However, I found much more. I had the opportunity to learn about glomerular diseases with specific reference to my own patients. These high-yield resources have an impact for me to be able to deliver evidence-based medicine to my patients. I'm finishing up with an expanded skill set in nephrology as well as generic skills, and also a worldwide network of connections. I'll strongly encourage those keen to improve the lives of their patients to apply for this innovative program. Really has been a transformative time.
GlomCon is the best thing that has happened to me during the pandemic. It has given me the opportunity to learn from and interact with renowned trailblazers in the field. The GlomCon experience has equipped me with much knowledge in glomerular diseases, as well as skills in research and presentations that will definitely translate to better care and outcomes in my patients.
It felt extremely great to be part of this GlomCon Fellowship program. It was one incredible learning experience. I definitely feel that it would change my approach and outlook towards glomerular disease, and I would definitely recommend my fellow colleagues and juniors to be part of it.
I had a wonderful experience. The lectures are fantastic. I was also able to meet nephrologists and fellows from all over the world and expand my professional network. I highly recommend GlomCon's virtual GN fellowship.
Being a nephrology resident, GlomCon has really given me an opportunity to do some in-depth reading about the diseases and the topics that we have discussed. I feel like I've developed a greater sense of how far we have come in our understanding of these diseases, and also of how much we still have left to learn.
These not only increased my knowledge of glomerular diseases, it allowed me to keep up to date with the literature, to hone my presentation skills, and also provided me with a new network of nephrologists to engage with. I was lucky enough to be part of the inaugural GlomCon Fellowship in 2021. I would encourage any nephrologist or trainee to apply for the upcoming cohort. I particularly enjoyed the insights from around the world, and also the adult approach to paediatric conditions. I had a ball.